welcome everyone to this ÖFG Peaceful Change Roundtable discussion, which is entitled Science and Politics, Responses to COVID-19. The background to that is if we watch TV now, if we look at newspaper articles, if we turn on the radio, then we oftentimes find two different groupings, or seemingly two different groupings of actors. There is the science, the natural science part, medical doctors, epidemiologists. And on the other side, there are the politicians who are supposed to make good political judgments. At times they seem to be successful in doing so, and at times they seem also to come down on misjudgments. Sometimes the two may not always find it that easy to talk to one another, because obviously they have different experiences, different socialization processes. And this is why we decided to get a little more into this matter with this roundtable discussion today. I am delighted to have a really wonderful panel here with two speakers and discussants. And let me briefly introduce you to the two speakers. The one is Kelley Lee. Her training is in international relations and public administration. Lots of experience in the global health field, over 20 years at the London School of Hygiene and Tropical Medicine, amongst other things, has worked closely with the UN on global health, with the World Health Organization, specialized in communicable and non-communicable diseases. She has in particular a project on tobacco at the moment, has published very, very widely, amongst them 13 books. And she's joining us today from beautiful Vancouver. Kelley, welcome to this panel discussion. Thanks a lot.
Thank you for inviting me.
Then we have Professor David Heymann. He is an epidemiologist, so he's Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine. At the same time, he is also the head of the Center on Global Health Security at Chatham House. He has lots of experiences with communicable diseases, has worked in the field, amongst other places, in Africa, has expertise on AIDS, on SARS, polio, Ebola, smallpox, and so on, also published very widely, over 200 peer-reviewed articles. David, thank you very much for joining us today. We're very happy that you're here.
Thank you, Markus. Thanks for having invited me.
Just a few things to the audience about how we're going to do this now. I decided not to be the discussant, and before we went online, so to say, we're joking about this already a little bit. I just really don't have the necessary expertise for doing so. Our very own alumna, Stephanie Strobl, who is both a medical doctor and an IR specialist. I think she has it, or I'm very, very sure that she has it. And Stephanie, thanks a lot for doing this and for joining us today.
Sure, my pleasure.
And just one more thing, if you are interested in asking questions, making comments, you can do so. If you do that on via the Facebook stream, then it's via an email, which is written on the Facebook page, and the email will then be forwarded to me. If you are listening to this via Zoom, then you can use the chat function and ask questions there. I'm going to let Stephanie and the two panelists go for about 45 minutes or so. And then I'm going to come in and gather all the questions, and in that way, it's going to be quite interactive as well. So without any further ado, Stephanie, I'm going to hand over to you.
Thank you, Markus. So first and foremost, please let me seize the opportunity to thank our panelists once more for joining. It's really an honor having you on the panel, given your expertise and just knowing your work. So thank you very much. Also, thank you for all the DA students and for the DA alumni that have just tuning in. So welcome to our discussion. We're about to discuss something that's very important. It has always been important, the interface between politics and science. However, it has never been more, I don't know, maybe current, like up to date. because of all the media coverage, for example, on COVID. So you hear a lot about it in the news, and maybe it's difficult to make sense out of it. So that's what we're here for. And yeah, let's dive right in. So this is about science and politics. So we have experts and politicians meet in order to make policy in the end, because I think that we all agree that policy decisions should be based on actual facts and science. But as you can imagine, these are two very different kinds of education that collide, so two different worlds. And yeah, I would like to start maybe with a personal experience. I guess, David, you know how what it is like to be the expert that has or is asked about policy advice. But I suppose it's not always that easy to give it, as you might speak a different language and have different problem-solving capacities. So do you remember a point in your career where you've been challenged with giving policy advice and maybe having some troubles with it?
Well, I'll start by saying that, you know, I never really believed that politics and the technical part of public health could work together. And during the SARS outbreak, I was in a position at WHO to be leading the response of WHO for the outbreak. And we had a very powerful director general at that time, Gro Harlem Brundtland, who was a pediatrician, but also a former head of state. And one day she told me, she said, well, it's time for you to go out to Asia because there's a head of state meeting in Asia. And she said, I can't go, you have to go. And I said, well, I don't think it's in my place to go because I work only on technical issues and not on political issues. And she looked at me quite in surprise and she asked me how old I was. And when I told her, she says, you mean you've come all this way and don't understand that it's politics that drive public health? And so I think she was right in that it is. I know she's right. Politics do drive public health, but it's very difficult many times to drive that public health, those politicians. And you know, even though you might have all the evidence, they just don't agree with you in the end, and they have to make a decision based on other information that they have. One of those, I think clearly, it wasn't me personally involved, but it was an issue with an outbreak of Ebola in DRC, the most recent, not the most recent one, but one before that, when I was on an emergency committee. And WHO was trying to see whether or not this should be called a public health emergency of international concern. And there was concern that if it was called international concern, a public health emergency of international concern, the rebel forces who were making it very difficult in that area to work would actually take this as some type of a hostage that they could keep and interfere with the response to the Ebola in order to spite the government against which they were rebels. So that was an area where politics and politicians really didn't get in the way, but were very important in the decision that was made. But I'm sure Kelley has many more experiences than I do.
So Kelley, you want to add to David's experience?
Yes, well, I'm not a technical expert in the way that David is, but I have, you know, as an academic, studied global health politics for a number of years, and that's allowed me to move, I guess, between people like David and people like, you know, Gro Harlem Brundtland, and study that goes on and how things get done, but also sometimes don't get done, and there can be frustration. I've observed in meetings, for example, when there's this sort of disconnect or a lack of understanding of the different roles that they play. Experts might see politicians as sort of short-term in their thinking and perhaps trying to oversimplify really complex issues around health and disease. And also maybe even unprincipled at times because they tend to put political goals often before public health ones. So public health people might see that as quite, you know, unprincipled. Experts, you know, if you describe someone as political, it's not a compliment, you know, it really isn't. And then on the other side, politicians might see experts, I've heard experts described as pointy-headed experts. Sometimes, they're too scientific, they're too technical, too idealistic, and out of touch, with reality, sort of thing. And so you see these frustrations sometimes come together, and around global health diplomacy is to try and bring those two groups of people together in a way that is complementary and is mutually supportive. And that's sort of what I've been trying to do in the last few weeks is, when commenting on WHO, is to show that yes, it's an organization, but that's not a bad thing. That politics thing, it's just that we need to see how we can get together in a productive way.
So what I get from this is that basically the expert is asked about his opinion or his assessment or evaluation, but then in the end you have maybe facts, you have science-based plan to go, but then the politician decides on other factors about how to deal with it. But then in the end, I mean, do you have the feeling that politicians actually trust in science and that they take experts actually seriously? Because I have the feeling, like, for example, I've read a study that also the trust in science depends on the political spectrum you're in. So do you actually, being the expert, feel that you're taking seriously? Or is it just, I don't know, something that you do in order to make your argument with, yeah, we've heard our experts and now we make the decision that, and then you go on. So how do you feel valued as an expert?
Maybe I'll start out, Kelley, by just saying that, it depends on how well you package your information as to how well it will be received by the politicians. Remembering that they have a very short span of attention on one particular issue because they have many different issues with which they're working. So if you can package the information in such a way that they can see the importance and also can see a political benefit to them during the coming period of time, they're more likely to accept your recommendations. And so it's not just giving them information, it's giving them information and evidence in the right package. And that package can then help them to move their political career ahead, while at the same time doing what's right as far as making policies. And I think it's always important to remember that we think differently, yet we need to work together to make sure that our messages are mutually understandable.
But isn't that theoretically going too far? I mean, we all would like to have policy decision based on science and based on facts, but then in the end, as an expert, as a scientist, you already have to think about how to sell it. I mean, isn't that overstepping the line because you're not democratically elected, for example? And I don't know, it just appears weird to me.
Well, I think the more you work with the political leaders, the more you understand how you need to package things so that they can understand it and move it ahead. So I think rather than being dangerous or being political, it's actually being clever as a technical person to make sure that your messages and the evidence is understood and does lead to the right decision. But I'm sure Kelley, again, may have very different ideas on that because she's really much more versed in governance issues than I am and in political issues. So I would turn Stephanie to Kelley. Yeah, sorry.
Thank you, Dave. Not sure about that. I think, I've studied governance quite a long time, and I think what David is saying is right. I mean, ideally, what you want to do is have this complementary role. But you also have to recognize that at the global level, it's not just a kind of larger version of what happens at the national level. So if you look at a Ministry of Health, you have civil servants and experts advising a minister, and the minister comes and goes, with political cycles. They get elected or they move on within an administration. They're not technical experts. They rely on the civil servants and the scientists to really give them the best advice. So they really need those experts. But when you go to the global level, it's not always that clear cut, and it's actually a more complex environment. So for example, the political and the technical roles become quite blurred at times. So we were talking about, previous director generals of WHO, and WHO is kind of like the equivalent, I guess, of a Ministry of Health for the world. But it's not quite the same, but it's kind of you think about the tradition around the director general. They are a political figure, they are political leaders, but they also have to be a technical expert. And so traditionally, the director general has been either medically trained, up to this point, medically trained, or at least have a PhD in a subject that is relevant to health. And so they have to have both. And you don't have that at the national level. Ministers can have all sorts of backgrounds, usually law or something like that, and career politicians. So the best director generals have actually been those who have combined very good technical skills, but also good political skills. And they're hard to find. Those people are really hard to find. And then conversely, what you have are technical experts in WHO or in different global health initiatives who may be appointed for political reasons. So in a Ministry of Health, say in Austria, you don't have to have a staff appointed according to, what federal state they're from. That's not necessary. But in international health, in global health, you have to have some sort of distribution of staff so that there's, not one country dominating. So there's a kind of political process there. So what we have are technical experts put into place for political reasons, and then political leaders put in with technical expertise. So, there's this kind of dual role that is supposed to play. So this creates a really more complex relationship between the politician and the expert. It's not as clear cut as you would have at the national level.
Yeah, actually, personally, I was very surprised when I've been to Geneva in February, and I've been interviewing a lot of career diplomats, and they were telling me, yeah, we negotiate on behalf of our country at WHO. And then I asked them if he had any idea what he was doing, if he had a medical education or anything. And usually the answer was no. So you had all these high-class diplomats being there, being briefed by their Ministry of Foreign Affairs with a kind of lack of coordination from the Ministry of Health. So that was actually very, striking to me that actually key issues are negotiated by politicians. And then I couldn't see how the experts could come in. And also knowing that obviously it's a difference what you negotiate. So it's way easier to include scientific knowledge when it comes to standard setting. For example, WHO is very accepted for when it comes to standard setting. But then when we come to a crisis like COVID-19, then if it comes to disease control in general, maybe, then it's rather vague. So then it's WHO is, for example, not so accepted anymore in leading this. So that's quite striking to me, to be honest, that it's not only blurred between experts and politicians, but also in between when you consult an expert and you believe in him because standard setting is a bit more comfortable for you. And then when it comes to a more like security field, then all of a sudden, maybe not, then maybe it's more contestable. So do you think that comes out of the mix in between politics? So the more politicized an area gets, like when it comes to disease control, maybe it's a little bit of the security field that comes in. So that's why it may be more difficult to negotiate and to cooperate. What's your take on that?
Do you want me to go, David?
Sure. Mm-hmm.
I think that there is this diversity in global health that people don't recognize. There's diversity of interests and diversity of policy goals. And so bringing in, something like the pandemic, it's not just a public health emergency, it's an economic emergency, it's a political emergency. And so you suddenly have all these players who are not used to maybe working together on a day-to-day basis, and that makes it far more complex. And I would also add, Stephanie, that, who is considered an expert in global health is not always that clear cut either. I think the public seems to see experts as maybe, people with white coats, the medical doctors and the scientists. They're the experts in the public's eye. But if you think about who we consider as global health experts during this pandemic, David is a no-brainer because of your long career, David, and infectious diseases. But academics like me have been asked about what is going on. But if you look at who the media is looking to comment at this time, it's really interesting. So one of the people that's come forward, for example, is Bill Gates. To see funders as experts because of a lot of funding. So people in the business world are consulted. There's a certain editor of a very famous medical journal who's very highly influential and is often a commentator, not just an editor. Of course, I'm talking about Richard Horton. And then there's people like, there's sometimes journalists who are supposed to be reporting on global health, but have become the perceived experts. And there's one in particular who, it's often in meetings that I've been to are looking at the reform of WHO, post-Ebola and so on. I'm speaking of Laurie Garrett, she's a journalist, but she's become seen as an expert. So all of this is being put into this kind of very complex and in real time, events unfolding. And it does become, I think, confusing. Who is the expert and what are we commenting on? There's so many issues at play, and we become a kind of a catch-all, I guess, and global health is seen as a very multi-dimensional issue. And this is, I think, what's happening at the moment. We're seeing that, it's far beyond just public health. And this makes it really difficult to navigate between the political and the expert worlds.
So, David, do you want to add something to that?
Yes, Stephanie, thanks. I might just add to that, the world is full of geopolitical tensions today, especially between the US and China. And it's really quite difficult to figure out how things might play out politically. But technically, things have been working out very well since the very beginning of this outbreak, because all countries, China, the US, Iran, European countries, every country in the world wants to and does share information with WHO. And that's why at a technical level, the technical arms of WHO have continued to work incredibly well, despite these political tensions at the top. And the evidence of that is the rapidity with which we've understood about the virus, how it transmits from people, from person to person, how it infects people and what the course of disease is in people. A whole series of things that we know because of this global sharing of information, which is occurring despite these political tensions, these geopolitical tensions at the top, that you would think are blocking all discourse between those countries. Yet the Chinese and the Americans freely exchange their information at WHO and permit WHO to, as it should be doing, leading in establishing best practices for this outbreak. So, I think it's always important to look at what's going on at the technical level of WHO. It's the same with these diplomats from Geneva who you visited, Stephanie, who come to WHO and make the decisions with WHO. Behind them has been a whole series of consultations in their countries with technical people, with political people who have come out with a briefing for this political leader or this ambassador or whoever it is before he or she goes to the WHO assemblies and makes those decisions. So the technical drives political in many instances, but then all of a sudden something else may come in that changes the political minds. For example, if there's a very difficult discussion on intellectual property, it may be that the government fully understands the issues and the political leaders understand those issues, yet they're being lobbied by other groups to not accept something which WHO wants to do about intellectual property because it may harm what they're trying to do. So it's very complex, as Kelley said. And you have to be understanding that the political drives many times the decisions, but the technical drives the political in most instances.
So you are happy with how things are going now with COVID, with information sharing and everything? Because I mean, in the end, you also, the longer we are in this pandemic, the more criticism is actually getting expressed of information sharing and maybe a bit too late, maybe not being transparent enough. What do you say to that criticism?
Well, people are still talking about what happened in January and we're already in June. And what we need to do is to keep working together, as we have been doing since January, to try to mitigate this pandemic and try to figure out what its destiny really is and how we can best deal with this pandemic today. There are many political promises. Oh, there will be a vaccine. We won't have to worry. There will be this, there will be that. We have to forget all that. We have to forget what the modelers are telling us really, and just get busy today doing what Germany has done, what many countries in Asia have done, and that is continue an outbreak response, making sure that you interrupt all possible chains of transmission, while at the same time moving ahead with mitigation such as physical distancing and other things. And really, we need to spend more time getting the general population to understand what their contribution must be if we're going to, in the long term, stop this pandemic from killing people.
So on the technical level, I hear that it's quite successful and that lessons have been learned also from previous crises, like for example, SARS in 2003. But then knowing that maybe technically everything is working out with information sharing and coordinating response, but then on the other hand, still governments criticize and use it. So they drag it to a political arena and blaming each other. So Kelley, if you would like to comment on that, then even if the technical side of it works and actually everybody's happy in at least how data is shared and how we can work with this pandemic, but then how can it be that actually this is still used politically? Like, what do you think about that?
Well, yeah, I've been talking about this a lot recently, and it's undoubtedly there's a lot of deflection of blame. I have to say, you have to call it out that this there's other agendas at play here, and we can't confuse those. There is an election coming up in the US, and there has to be an explanation of why the US is the epicenter of this outbreak, and why how many 100,000 Americans have died on this administration's watch. So of course they're concerned and they need to explain that. But beyond that, I mean, there's expectations of WHO, which I think have been really I guess an illustration of how little people understand the organization and how high the expectations are. I've heard all sorts of questions about, well, why didn't WHO just march into China and get that data, and why didn't they demand it stronger, and so on. And I think it all comes down to what we've created as an organization and what authority we've given it. WHO did exactly what it is designed to do, which is really to collect intelligence on this outbreak when it was provided by China, and disseminate it with the world and provide advice, provide the best advice it can based on given evidence that we have and emerging information that we have. And they've done all that. They've done it on a daily basis. The officials have been giving briefings, tirelessly, really, for months now. Going back to January, there's going to be some sort of evaluation in due course. But at the moment, as David says, we need to focus on this pandemic. We can't be picking apart what happened in January when we're really needing to look forward. So the reasons for these political criticisms, which really only come from now one source, it is for a domestic reason, not for a global health reason. We've seen seen this play out. The key thing, though, is, do we have a WHO that we need to have going forward? Does it have the authority that we want it to have to really obtain the kind of data that we need in a timely manner, and in a fulsome, in a full comprehensive data that we need to keep the world safe? And we probably don't, because state sovereignty as it is, we give states the ultimate power to decide to share information or not, and we need to find other ways to do that. So that's the discussion we should have after this pandemic is behind us, and certainly not now.
So just maybe for our students, for information. So according to the international health regulations, which are legally binding on states, states need to notify as 24 hours as soon as the event occurred, if it may have the potential to be a public health emergency in the end. And the thing is that there's also no sanctioning mechanism in place. So even, I mean, number one problem will be to actually prove that there has been maybe wanted delay, and on the other hand, there's no sanctioning mechanism in place. So even if a state did not comply, there's unfortunately no sanctioning mechanism. So David, do you think this is a weakness of the IHR, for example, that you have all these legally binding rules, but you cannot really control if countries comply or not?
Well, I think the IHR have actually played quite an important role and a good role in this pandemic. You know, the emergency committee first met, I think it was the 22nd of January, and this was 2 weeks after, well, first of all, the 5th of January already. WHO had posted on its outbreak list, which goes to every international health regulation focal point, that there was an outbreak of unknown pulmonary disease in China. Many countries took this to heed immediately, and countries in Asia began looking, and when they found this coming into their own countries, they stopped it with outbreak containment activities. WHO presented that information to a group that I chair called the STAG-IH, which is an advisory group, the second week in January, and we recommended that the Director General call an emergency committee meeting, which he did the third week in January. So between that period of time, the first committee meeting met. The committee said they didn't have enough information. I'm not on that committee, but they said they didn't have enough information to make a decision at that point, and they asked for more information from China. WHO requested it, the information came in, and on the 30th, it was called a global public health emergency. If that's not enough to mobilize countries, then countries aren't really paying attention to what's going on in the world. And you know, countries that say they weren't warned were warned. They were warned the 5th of December, and they had a tremendously great warning on the 30th of January. I'm sorry, the 5th of January, and then the 30th, they had a great warning. And then finally, the Director General said he had to call this a pandemic because there wasn't enough attention being paid to it. So I don't know what more a Director General could do than to do those things and try to make the world understand that there was something serious going on. But Kelley will look at it, I think, from a different point of view. And it would be interesting to hear, Kelley, what your view is, whether or not the IHR really is functioning. To me, it is.
Well, I think it certainly worked the way you described up to the point of the declaration of the public health emergency. I agree. You know, there was plenty of time. Countries all got the same information at the same time, and some countries paid attention and some didn't. And I think that's, you know, the story of this pandemic. Beyond that, though, it's what is interesting is, and something actually we're studying here at Simon Fraser University and with colleagues around the world, is looking at compliance with international health regulations since that emergency was called, and specifically around travel restrictions. So this is a point of contention as well, of course, politically, as well as I suppose economically and public health wise. And so WHO made a recommendation that it was not that countries should not adopt travel restrictions, specifically around China. And what has happened since is that many countries have, well, in fact, all countries have adopted travel restrictions of some kind, and they're now maybe moving to lift them. And so we're interested to know, does that mean that nobody is listening to WHO? Does that mean that the IHR is dead in the water because nobody is actually paying attention to that restriction or that recommendation? So that's something we're trying to look at, because if different countries are doing different things or not coordinating with WHO, that's a problem, because, you know, in a global pandemic, everybody is interconnected and you need to have a good coordinated response. We're not saying whether these measures that have been taken are compliant or not compliant. The question is, why were they adopted? And to what extent can we say they're compliant? To what extent is the IHR still a valid international treaty? But what I said earlier, though, is it's about authority. So yes, WHO does not have the punitive measures or the enforcement measures to require countries to, you know, if they don't provide information, or they're suspected of not providing information, WHO can only use diplomatic means to encourage countries to come forward. And is that enough? And that's the big question. And there's been all sorts of ideas about, should they have WTO type countermeasures? Should there be inspectors going in, like weapons inspectors? Should there be sort of carrots and sticks, incentives, but also punishments for not complying and so on? This is all swirling around, and there's a lot of discussion. And I think this is actually where international relations, international affairs, scholars and students can come in and, provide some insights on what would be an effective way to encourage stroke require countries to be as open as they can be. I don't know, to be honest, if China has been timely open. I mean, there's all sorts of accusations going around, timings, how much information was shared and so on. I'm just, I'm focusing on post January 30th, like David, and what's happened is really what's happened after that date, and not what happened before.
Stephanie, I might just add a little bit also about the travel recommendations in the IHR, because the IHR were established first in 1969, when countries didn't have access to the information flow that they have today. And when they depended on WHO, which had that information, to really make a decision for the rest of the world and make a declaration, because they just didn't have that information. In 2020, we have all the information we need from WHO, from many other sources at the national level, to make recommendations based on the national risk assessment. And some of those risk assessments say that we should try to postpone travel to and from China. And that just is a normal way that things are occurring. So it may be that the IHR should not, when they were revised in 2005, have continued to put in the regulations a recommendation on travel and trade. Or that recommendation could have been simply a recommendation to make sure that travel continued for humanitarian response teams that were necessary, and that trade continued for essential goods for the pandemic. So there are ways that these could be reinterpreted without rewriting them, that would say that travel and trade recommendations are really only pertaining to the pandemic itself. And therefore you could keep the regulations as they are, but interpret them differently. And certainly countries have a right to make their own risk assessments. And if they say that travelers are coming in and they can't deal with the outbreaks that might occur from those travelers, they have a right in their own legitimacy to say, we want to postpone travel coming in from China until a time when we can deal with it. So maybe it's not the way the IHR are written, maybe it's the way we're interpreting it. And maybe it needs to be interpreted in a bit of a different way. But I'd like to hear, Stephanie, what Kelley has to say about an idea like that. Would you permit that to go back to Kelley? Yeah.
Yeah, those are all great points, because it isn't clear when and what conditions travel restrictions are effective or not, and the evidence is kind of mixed, and I think the jury's still out. I think the way that the IHR is being applied has to be looked at, whether the early advice was nuanced enough, and whether member states were really even interested at that point. They're sort of not paying attention. So other than reaching for travel restrictions and slamming borders down and so on, I mean, we know that they can have huge impacts beyond public health. And so having that data, having that, I guess, understanding that if you are going to close your border, just remember that these number of people we put out of work, or this will have an impact on your economy. There will be emergency supplies that may be cut off and so on. If politicians or policymakers who are making these decisions have a fuller understanding of these kind of really complex impacts, I think that would be a more effective way, of encouraging coordination, that they'll think more carefully on the evidence, rather than I'm really suspicious of this country. I don't like Europe today, I'm going to close the flights. And this is what we saw over the last few months, is kind of a slightly, non-evidence driven, as a polite way of putting it, ways of making these decisions. So it may well be that the IHR in themselves are not the problem. But I think some legal scholars have said that, you know, there needs to be more flexibility, I suppose, or maybe more ability to create decision tools of some kind to make these really complicated decisions about whether or not to go with certain measures. These are called non-health measures. That's Article 43. And, you know, when do these get put into place? When do they not? I think that maybe member states didn't feel that the advice was nuanced enough.
But isn't the IHR's openness to interpretation already a source of criticism? Like, for example, when it comes to the public health emergencies of international concern, as the definitions are so vague, sometimes it's difficult, or I have the feeling that there are different interpretations of it, but at the same time, this is a source of criticism because that makes the WHO vulnerable to, for example, politicians using that. So on the one hand, I absolutely understand that you say that we need more room for interpretation, but on the other hand, this might also be a weakness for the document, don't you think?
Well, the problem is though that, you know, each outbreak's different. You know, each time we have an event, a public, a disease event, as it's called, it's very different. And this is why you have these international emergency committees come together. And, you know, these are top officials. They're not, they're experts. They are, you know, senior officials who give their best advice based on the evidence that's coming forward about the disease event. So you can't make hard and fast rules. You know, it really is about principles in the international health regulations. There's no magic formula that you come up with that says, you know, if you have X, then you do Y. I mean, that is impossible. Every event is different. Every, the timelines, the pathogen, the countries affected. So it would be really hard. What you do is assemble the best advice you have. Of course, it's going to be, you know, imperfect. We're working in an imperfect environment. Information is scarce sometimes, real time. It's a novel pathogen. You know, we're learning as we're going. You know, it's building the plane as you're trying to fly it type thing. And people have to be understanding of that process. I think there's a lot of armchair experts, you know, having hindsight and saying, oh, should have done this, you should have done that. Well, that's easy to say now, right? But you have to understand you're working in a vacuum oftentimes and under huge pressure to make decisions when you don't have full information. So I personally think that, you know, WHO has done a remarkable job in handling this. It's, of course, you know, it hasn't been perfect, but it's been, you know, not a disaster, I think that some people make it out to be.
So just as a side note for our students, maybe, so as soon as there's an event that may be a public health emergency, the Director General of WHO can decide to convene an emergency committee, and there will be a lot of experts of a geographical representation chosen from the roster of experts, and they come together and discuss the issue and then give advice to the Director General whether to declare a public health emergency or not. But actually, I really like one point that you just highlighted, Kelley, because transparency seems to be an issue. So the WHO is doing a lot. WHO is publishing the lists of experts on the emergency committee, for example, but the information of how or what comes out of the deliberation usually comes in quite late. I mean, for a reason, you need to protect the experts. But can you think of a remedy of how to make that whole EC process more transparent? Because I sometimes feel that even a lot of top officials don't really understand how it works and what comes out in the end. And what can WHO, for example, do to just give a little bit more insights, not necessarily of what exactly happens during that emergency committee meeting, but I feel that there's a lot of communication issues going on. So even top officials can't understand who's on there, what they are discussing, and what's actually the proceeding then in the end, and what the Director General can do with it. So do you have any possible scenario how this could be done better?
Yeah, I don't know if I have a magic idea, but I do find that that WHO is incredibly low profile, and people don't understand what goes on in the organization. And having spoken to so many people, they find it, a revelation, like, oh, is that what they do? And they do a lot of things that are really below the radar in terms of keeping us all safe and healthy, and everything from naming the disease, which people laughed at, but it's really important. We all discuss and define the disease in the same way. To things like collecting data and disseminating data and expert advice, which is not always the most exciting. And I think people, want to see people swinging into action and running down hospital corridors and so on. So they don't appreciate that this committee work is really fundamental building blocks to what people do in clinical settings, in public health settings. So maybe WHO could do a better job of really informing the public about what it does, that it's not always the most exciting, for the media, but it's very, very essential. So these committees that meet, yes, it's pretty mysterious. And I think that then opens up suspicions, if you want to create suspicions of what is happening in those committees. And so if WHO could perhaps engage more in public information about how these committees work. I don't think they're going to be publishing any transcripts and any, that these are diplomatic as well as scientific discussions that people have to be open about. So they're not going to be have public records, but for people to understand at least what is considered, how do they go about, deciding what are this kind of criteria and how do they interpret that criteria would be very helpful. I think that would go some way in allaying people's concerns.
So David, do you have anything to add for that?
No, I think that's right. I think transparency is important. And, after every emergency committee, there is a press conference. And at that press conference, they give the results of the committee discussions. Remember, though, that the Director General doesn't have to take that recommendation. The Director General, even if the committee recommends that this might be this is a public health emergency of international concern, the Director General has many other sources of information as well. And based on that other information, he or she can make a decision different from what was recommended by the emergency committee. One way of being sure that there is transparency, though, is for the journalists to ask the right questions at the emergency committee meetings, at the press conferences, after those meetings have finished. And I'm sure that they'll get the answers if they ask for them. As far as transparency, though, Kelley is right. The meeting itself has to be held in confidence or people won't speak freely. And they need to speak freely. They need to debate. They need to discuss. And then the decision has to come out from a consensus. It's never a vote. It's a consensus among all the members of that committee. So, I think the IHR are an interesting tool. Remember, the IHR were negotiated by 194 countries, members of WHO. WHO didn't write them. The secretary didn't write them. They were told what they should do by 194 countries. And if the countries don't like them, then they must change them based on the process that goes through the World Health Assembly and its executive board. So there are many opportunities to change, but countries need to be sure that they want to before they do it. And then they have to undertake it. And it's a long, grueling process to open up a treaty and then to renegotiate.
Stephanie, can I just come in quickly? Yeah. So I've gathered a few questions now. So both from Facebook and from Zoom, and there are basically 3 blocks of them. The first one is about how the global health field does in contemporary politics. So if one looks at different kinds of fields, like say economics, security, then there is oftentimes a lot of concern nowadays. With regard to the global health field, I think it was in the probably the early zeros with the remaking of the international health regulations and everything, the things seem to really move forward. So the question there basically boils down to, are we now moving backwards? So I think there are some voices in the literature that suggest in the last 5 years or so, there's been less willingness of this multilateralism and this cooperating together. The second cluster of questions is about who is particularly affected by COVID-19? So there are questions about whether COVID-19 and smoking, what the repercussions of that are, COVID-19 and its impact on lower income communities. So perhaps if you could say a few things about that. And then the third question, and I have to be honest, that's a little bit of mine because I'm interested in this. From past experiences, say at the emergency committee, there is a chair, and does this chair, because the chair does certain things at the press conference, and can you explain to us a little bit? Obviously, you can't go into any details there, and really from past experiences. How the dynamics are with that. I'm just asking that question because in, say, normal diplomacy, the chair can be actually very powerful. So chair can come up with the idea to postpone a meeting to the next day, to repackage a proposal or something like that. So the chair really is basically a primus inter pares. So is that in the emergency committee like that as well? And please, whoever wants to go for it, for any of those, goes for it.
Kelley, do you want to try multilateralism?
Yeah, that probably is a good division of labor there. I mean, global health, studying global health diplomacy, one of the things we study is where global health is positioned in relation to the broader global agenda. So trade, security, migration, and so on. Global health is always competing with other agenda items, of course. And so we're fortunate, I guess, in global health in that in the last 20 years or so, global health funding spending has substantially increased from around the late 1990s. It certainly petered off and leveled off with the financial crisis about 10 years ago. But certainly it's risen in terms of its support, political support that it's been giving. And so that is interesting in itself. So are we then, retreating from that? Are we seeing a kind of decline of maybe global health cooperation? And I am concerned, coming out of this pandemic, which is probably the best illustration of why we need multilateralism. Anything that illustrates this, that every country should be in on building up WHO, strengthening, if not WHO, something else that allows us to have collective action. This pandemic is really an excellent illustration of this. However, what we're seeing is these, geopolitical forces, which David mentioned earlier, and it's very concerning, that you cannot dismiss those kind of concerns, and we could go either way. So I think nationalism, multilateralism, there's some really hard choices to be made. If the US re-elects President Trump, I think we're going to see a continued trend in that country towards a retreat from multilateralism, which is not a new thing. It's been going on for some time, and it's always had a kind of hesitant relationship with treaties and so on. This is going to be concerning, and I've given the message that even if we all live in a cave as hermits, we still need to understand that our health is interconnected. There are wild birds migrating. There's climate change happening. We can't escape those things, even if we become hermits and live in a cave. So this is my concern. I'll stop there because I'll let David speak about maybe the COVID impacts, which I think he's a great person to speak on that.
Well, thanks, Kelley. I appreciated that answer, and I think it's absolutely right that we're seeing a very difficult time for multilateralism. Regarding COVID itself and the infections that are occurring, everybody is susceptible to being infected with this organism. But we know that there are populations that have very serious illness as a result. And those are people who have comorbidities, such as lung disease, which is often caused by smoking. So people with lung disease are at great risk. People with heart disease, people with high blood pressure, people with comorbidities, diabetes, are very great risk of serious illness, whereas the rest of the people generally have a mild form of disease. The elderly, of course, are another group that are at great risk, And they're at risk many times because they have these comorbidities that others have, and because their immune system is not functioning the same as it did when they were younger. So to directly answer the question, yes, smoking is a risk factor for serious illness from COVID infection because it damages the lungs and it causes lung disease, which is a risk factor in itself for serious illness. So everyone can be infected. The elderly, those with comorbidities, are most at risk, but we understand that children even can have very serious illness, but not to the same extent as adults. And we know that about 85% of people who do get sick have very mild illness, whereas only 15% have serious illness. Regarding the emergency committee and the chair, I actually had the privilege of chairing one of these emergency committees a few years back for the Zika outbreak. And, you know, I'll just try to take you back into what that looks like, because it's a very interesting way that the committee meetings are organized. At WHO, there's a group of experts in law, in various other parts of diplomatic public health, who are sitting there along with the technical people from WHO, who provide information to the emergency committee. But the emergency committee is virtual, just like we are today. The emergency committees are virtual. And so they're run by a chair. And in that committee meeting, there are people from the countries that are affected who provide information and answer questions. There are topic experts who provide information. For example, in Zika, it was information about the Aedes mosquito. And there were many other people involved as well, but it was a virtual meeting of 12 emergency committee members and the experts who advise them as they ask questions. Decisions are made by consensus. It sometimes is a short period of time till there's consensus. Other times, such as for this current public health emergency, it took a couple days. There wasn't a decision. They needed more information. They got it, and then the information was straightforward. So the chairs have a role to play in making sure that a consensus is formed. And so they must constantly be providing possible equations of what the synthesis of that information says and get a consensus that everybody agrees with that. So it takes someone who's had experience chairing to be able to do that. But more importantly, it takes a strong WHO secretariat to advise and to make sure that the committee is going in the right direction. So Markus, I don't know if that answers your question on the chairs, and I hope it's answered all the other questions from the students as well.
No, thanks very much. Definitely answers them. Thank you. Stephanie, is it okay if we end slowly but surely, or do you still have big questions on your mind? No, but it's about an hour, and that's usually a good time. So then let me take the opportunity. Thank you very, very much for a fantastic talk. I really learned a lot. To the audience, perhaps especially the younger ones among you, global health is a very, very important field, probably still quite a bit understudied, and probably in need of lots and lots of good ideas and bright young people who want to make a difference in the world. So perhaps in that way we sparked a little bit of your interest. Kelley and David, thank you so much for sharing your expertise with us. It was a fantastic conversation. Stephanie, thanks a lot for asking great questions. And then let me wish you a very nice evening. Bye-bye.